Hi, beautiful people. Let's talk about how to conceive twins naturally. Yeah, I know so many people have different reasons why they want to have twins. Some people want to have twins because it helps them to have the number of babies they want to have faster. While some people just cherish the idea of having two cute little babies, running around the house looking identical, wearing the same things, and all that. In this video, we'll be going over a few factors that, when they are rightly in place, a person can have a very good chance of conceiving twins. Factors that are out of your control as a woman. If these things are happening to you, then you are highly likely going to have twins. Number one is hyperovulation. So if you're the type that your follicles are usually more than one, more than two, you used to have multiple follicles every month. That means your body produces multiple eggs every month. Regardless of what you do, even if you're not on fertility drugs, whenever you go to check yourself, you're told that you have multiple follicles, sometimes on one ovary, sorry, and sometimes on both ovaries. If that is you, then just have it in mind that you have a high chance of conceiving twins. Another factor that may be out of your control is ovulating twice in a month. Some people ovulate twice in a month. So if you're in that category, you're highly likely going to have twins. Now, based off of what I just explained, you can now see that for twins to be conceived, it is solely dependent on the woman and the maternal side of the gene. Research has shown that if you have a high BMI, that is, if you gain weight, you have the chances of having twins. If you are older, if you're of the African American race, you have a very high chance of conceiving twins. Now, these are a few things that you can do to increase your chances of having twins. Number one is IVF or ICSI. So if you do IVF, you automatically increase your chances of having twins, because when they transfer the embryo, if you request for more than one baby, they may be able to transfer up to 2 or 3 embryos for you. Hopefully, 2 out of the 3 or all 3 of them may survive, and then you become a mom of twins. So IVF can help. Some fertility treatments can help if you're taking fertility drugs. The aim of these drugs are to boost your follicle production and to ensure that you have quality eggs, okay? So if you take fertility drugs, you're likely going to still have hyperovulation or multiple follicles in both ovaries throughout the time that you are on that treatment, and that can boost your chances of having twins. Another thing that research said when it comes to conceiving twins is if you try to gain weight, but men, I'm not advising you to gain weight, because I don't know if you're going to be able to gain it in a very healthy way in such a short period of time. Okay, so I wouldn't advise you to go ahead and gain weight if you're on the slim side, because, well, big people have twins, slim people have twins. Take folic acid supplements. Taking folic acid supplements can help to boost and increase your chances of getting pregnant generally. Also, you can get pregnant when you're older. If you try to get pregnant when you're older, your chances of having twins is tripled. But then it is a risk that most people may not be willing to take, waiting till when they are older before they get pregnant. So, but research has shown that older women are more likely to have twins. So if you're on the older side, this is already an advantage for you, all right? But if you're younger, I wouldn't advise you to wait till you're older before you get pregnant. You can conceive now, all right? You can apply every other factor and see if it works for you. The last one I'm going to take. If you're on birth control, try to conceive shortly after you stop taking birth controls. Try to conceive shortly after you have discontinued taking birth controls. I'm going to tell you why. If you've been taking birth control for up to 3 months, 6 months, you understand that what it does is that it regulates your follicle production, reduces your hormones to a level where you can't get pregnant. Now, if you discontinue using birth control pills, what the body does is that they come back with full force. Those hormones that you're trying to suppress by taking those medications will come back with full force. And if they come back, there is a likelihood that in the first 2 months of your cycle being normal, there will be high influx of hormones, and these hormones can help you achieve twin pregnancy. The first month or the second month of you quitting or stopping birth control is the best time to try.